All right, we can go ahead and get started. Welcome to today's webinar on hydrotherapy for people with neuromuscular conditions. My name is Hamera Osman. I'm the VP of Research and Public Policy at Muscular Dystrophy Canada. We're really pleased to be holding today's session. This is a very common question that we receive through our research hotline. Just for those of you who don't know, our research hotline is a way for you to contact us if you have any questions related to your specific diagnosis or getting a diagnosis, finding clinical trials, looking for evidence on how to manage a neuromuscular condition. And I was just mentioning to Andressa that, this has been a topic that has often come up to say, is there evidence behind hydrotherapy? Are there funding and resources for hydrotherapy? Who could perform hydrotherapy? How often? When? And so those are the types of questions that will be answered today. Dr. Andressa Marino-Buzzelli is a research associate at St. John's Rehab Research Program at Sunnybrook Research Institute and a research advisor for the Canadian Aquatic Rehab Instructors. Her current research project aims to optimize the uptake of aquatic therapy post-stroke through a participatory design approach. Andressa has led a multidisciplinary team, including people with lived experience who have experienced a stroke, caregivers, clinicians, and she's co-created an educational toolkit to inform on aquatic therapy post-stroke. Andressa has been involved in developing aquatic therapy research since her doctoral studies at the University of Toronto, and she graduated in 2018. Her long-term goal is really to bridge research and practice, which is such an important component here at MDC as well when we think about knowledge translation, really optimizing the use of aquatic therapy for balance, mobility, and functional independence of individuals with disabilities. I really want to thank you also, Andressa, as your work is focused on stroke, but really being here today to summarize the evidence and providing how that applies to those with neuromuscular conditions. So I'll pass it over to you, but thank you for joining us today.
Thank you, everyone. Thank you so much for having me. I'm really pleased to be here today and to share my knowledge of aquatic therapy or hydrotherapy with you all. I hope that at the end we'll have a chance to see each other and I'll be able to answer some questions from you. So I really want you to get immersed with me in this beautiful pool from St. John's Rehab. I usually, put that on my background so we can all experience aquatic therapy together, right? Just to give a brief overview of the aquatic therapy content. So I was given these questions, to be focused on in my presentation. So I'll be answering them today to the best of my ability. Okay, regarding the elements of hydrotherapy that makes it an effective rehabilitation strategy. Also, what does a typical hydrotherapy session involve? And how can hydrotherapy sessions be modified depending on the ability or the level of disability? And what is the evidence on hydrotherapy for people with neuromuscular disorders? So we will be focusing on the evidence for people and persons with neuromuscular disorders, okay? And I will also touch base on if hydrotherapy benefits children or adults more. Wow, so we need to define the term, right? So hydrotherapy is not so much in use lately. People, I think, are changing more to aquatic therapy or when is the exercises outside the realm of therapy, then they call water-based activities, right? But the term aquatic therapy is also referred as hydrotherapy or water therapy or simply aquatherapy, and applies to exercises in water for rehabilitation and health promotion, okay? And a variety of approaches and equipment are used in the water to optimize the client's health and function, okay? And also a variety of professionals. I was just talking to Omira before we started here that many professionals can apply aquatic therapy, including physical therapists, occupational therapists, recreation therapists, okay? So it's not a private, act of physiotherapists. All right, so what are the common goals with hydrotherapy? So from the therapist side, we we aim to, I think, working in the water really facilitates the three-dimensional access to the patient, right? It's so easy to move around the patient regardless of the position that they assume in the water. Also, enhance the delivery of manual techniques. It also facilitates our posture when dealing with the clients, improve our energy conservation as well, and minimize the risk of injury, right? Nobody's afraid, right, to fall in the water, especially with the proper equipment. On the client side, the goal of aquatic therapy is to facilitate weight-bearing activities, to improve movement amplitude, to enhance relaxation, promote gradual muscle training, also facilitate cardiovascular conditioning. We will see how immersion can facilitate that, and improve balance and mobility and promote functional independence. These are some of the main goals we want to achieve, right, with our clients, and they want to achieve as well with aquatic therapy. Well, I'm going to spend maybe half of our lecture really bringing the elements of hydrotherapy here, okay? The hydrodynamics and the thermodynamics that makes aquatic therapy such an effective rehabilitation strategy. Okay, so we have, the water has a physical properties, right? They're very different from air. As we enter the pool, we start experiencing, whoa, oh, I feel lighter. This is the effect of buoyancy, right? And also when we move, oh, it's not so easy to move. I feel some resistance. So because of the effect of the viscosity and the drag force, and we also feel a sense of security when we are surrounded by water, and this is due to hydrostatic pressure of the water. And also, if you are entering a therapeutic pool, you feel the warmth of the water because the temperature is usually set around 34, 35 degrees, makes it a very relaxing environment, right? And when we enter the swimming pool or the therapy pool, we also see this relationship between the water density and our body density, okay? So people with more like fat tissue around the body will float more. People with more dense tissue will sink more. So this relationship is also happening, okay? So I hope to clarify a little bit more of these components in the following slides, so we can have an idea of this rich and versatile environment and take this knowledge to apply in our use of aquatic therapy in the community or private, okay? So the first component, the property of the water that we want to study is the buoyancy. So the buoyancy is this upward force that is opposite to the gravity. That's why the buoyancy uplifts us, right? So we have this apparent body weight decrease when we enter the pool, okay? And this force is equal to the weight of the fluid that the body displaces in the pool, okay? So the more we are immersed in the water, the more we have the weight relief or the decrease in the weight bearing, okay? Offload, we can also say offload because it does offload the joints and the muscles. That's why one of the main reasons working in the water, exercising, it's really great for people who are not able to ambulate on land fully or do activities fully on land. The water favors these activities by increasing the flotation, okay? Well, not only that, so buoyancy, as this force is pushing us upward, we can also use the buoyancy to resist the movement. So when we're stepping down in the water, I also feel the resistive effects of the water. So we can also work in both, right? But we really experience the balance force when we have the offload. So here, just a few examples of a graph that measured their ground reaction force when people were walking in the water and in land. So the darker lines are the forces in the water, and you see how they are much less, right? The peaks of forces are not there. So the joints are not feeling that peak of force in the water, right? So these two studies show that above the people without a disability, and the graph below is from like obese woman, and they were just running stationary, and these forces were measured, and there was a decrease of 40–60% of ground reaction forces. So water does offload our body weight, okay? So the second property is the hydrostatic pressure. What is this hydrostatic pressure? Is the force that it comes like perpendicularly to our bodies, okay? It does compress. So if you come to get immersed up to your umbilicus level, like 1 meter, around 1 meter, the force that is exerted in your body is slightly higher than your diastolic pressure. So this makes a great environment for cardiovascular conditioning, because as this pressure increases, more blood is directed to the center of your body, to your heart, to your lungs, which helps your heart and lungs and cardiorespiratory system to get more conditioned. Also, as the water makes this pressure on your legs, it also aids in edema reduction. And another component important from the hydrostatic pressure is that also decreases sympathetic input. It means that you're more relaxed. It provides some information to the body that you don't need to be stressed or you don't need to be worried, because this is proven through the studies as well, okay? That reduces the flight and fight response of our body. So just an illustration here on how this hydrostatic pressure can shift the volume, right? So the literature shows that there is a increase in cardiac output. What is this? Is the volume that the heart pumps every time, okay? And also because of that, there is a decrease in heart rate, and some studies even show a decrease in blood pressure. And this pressure, if you go to get yourself immersed up to your neck, this pressure can really work as a resistance for your respiratory muscles, okay? And usually declines the vital capacity, but also it makes you work harder, a little bit harder. So it needs, well, if you want to get immersed to the neck, you really need to check with a doctor if your heart and lungs are prepared for that, okay? Because it will offer higher resistance for you. So we need to be in mind of the population that we are getting to the deeper levels, okay? I think if you have used the pool before, you experience this, right? That there is like more when we leave the pool, there is kind of an urgency to pee. And so because of urine excretion increase, right? Because of all this compensation that happens in our body. So you can see that aquatic therapy has this systemic effect, right, in our body. So we tell our clients not to drink caffeine or very stimulant drinks, okay, before the session, just to avoid have to leave the session to go to the washroom. Well, what is this study shows? So the studies of physiology of immersion shows then, okay, there is an increase of circulation to the center of the body, the heart, the lungs, and the organs are viscera, right? And after this adaptation happens, then this blood is redistributed again to the skeletal muscles, okay? So this means that you need to wait a few minutes until your body gets into this adaptation, until your muscles get the circulation back in order to increase the intensity of your exercise, okay? So I'll talk more about that later. All right, so we saw the uplifting, we saw this pressure around us, and also we can use the water to make resistive exercise to help them to train the muscles, right? So the viscosity is the component that helps us in that, because it's the friction of these molecules of liquids that result in resistance to the flow, okay? And one good tip for everyone: the faster you move in the water, the greater the resistance of the movement, okay? All right, so I wanna move faster and I want more resistance. So then it can increase, I'm gonna show you later how you can increase this body area to even get more resistance from the aquatic environment, okay? So the drag force is the force that pulls us back, right? As we move through the water, we create this turbulent flow behind us that pull us back. Then you experience more resistance of the aquatic environment. If you move sideways in the water, we will have less drag force pulling you back than if you move forward with a board in front of you. Okay, so these are ways to modify your session if you want to increase the intensity of your therapy session. Another very important component that many people, sometimes I see they don't use as much, but is the surface tension. When we are immersed in the water, have you tried to take your arm out of the water? So that surface of a fluid acts as a membrane under tension. So if you want to increase the resistance and motor control, you go through the water, okay? And to experience even more resistance if needed, okay? You can also use an equipment to go through the water, for example, a swimming board. If you want to go through the water and improve the strength of your arms, you can also use that, working the surface tension. Another effect of the water, this one is, I particularly, as a physiotherapist, I love this effect, the metacentric effect. It means that, so you are in the water, there is this force pulling you up, right? So this is the central, so there will be then a center of gravity pulling down, pushing down, and a center of buoyancy going up. When they meet, when they are aligned, you are balanced, you are perfectly okay, relaxed. But when they go to one side and the other to the other side, they create a rotational force in your body. And this is quite interesting in therapy, and I'm gonna show you later on. And we cannot forget of the thermal effects, okay? Because the water carries 1,000 times more, you know, like it's a 1,000 times greater than an equivalent volume of air in terms of heat capacity, okay? And it also transfers heat 25 times faster than air. So I do not recommend, you know, aquatic therapy below 28, 29 degrees Celsius or above 36, because it can be too hot or too cold. And because water transfer heat, you can lose heat very quickly if you are in a chilly water environment, and you can get yourself heated very quickly if you are as well in a very hot environment. So try to find pools that are around 33, 35, 29. And we see here in this table from Becker is that if you want to work more vigorously, yes, around 30 is better. But if you want just more therapy and relaxation, 33 to 35 would be ideal. And we know that some of our public pools do not offer that for their clients, but we try our best, right? To find pools between 33 to 35 to get therapy. But if you want to work harder a little bit, then a swimming pool around 29 degrees Celsius could be also good for you. So let's now think about what a typical hydrotherapy session involves, okay? One important advice that I would like to give, I don't know if there are therapists in the room or even to the clients and their families, is that if you are going to a pool for the first time, get yourself familiarized with that pool first, right? So take one session to be, there to see how your body will react to the temperature, right? What levels, try different levels of immersion, go to the shallower end, then moves to the deep end, and perceive how your body exercising there, how your body respond, if you get shortness of breath or not, if your respiratory muscles start working harder or not. So it's very important, right? Because water is so different from air. I really recommend this familiarization session before anything. But what we see in the literature is that usually therapists apply aquatic therapy in the same way that on land. We have a warm-up session, a main session, and a cool-down session, okay? So the warm-up session, we have exercises such as breathing exercises, stretching, flexibility exercises. So you get your body ready for the main session, right? So you start walking slowly and progressing to faster speeds, right? You can march on the spot. You can also just move freely in the pool, right? And there is a technique that's usually used for warm up. That is the Aishi. That is like some controlled movements and balance to get yourself familiarized with the environment as well. And they use a lot of breathing and relaxation techniques in this technique. And then in the main session, I really brought this exercise from the literature review that I'm going to show you. We work as well. We continue work with breathing. It's so very important to continue breathing properly during the sessions. And we do also some stretching. For example, the randomized controlled trial I'm going to present to you, they used mostly stretching and muscle training exercise of the arms, of the legs and trunk. But we can also work on balance exercises, walking training, swim therapy. Some clients, they want to learn how to swim, and then we can work on that. There are some as well, some aquatic therapy techniques. They are very particular. There are a Haloic, they call Haloic therapy, Bed-Ragaz ring method. And you can also, if your client is willing to and he tolerates well, he can also be jogging, jumping, kicking, and play games, right? It's a very great environment for playing games and for socialization, right? And it's very important, either physiologically, to take time to cool down after the main session, right? Then we go back to stretching, relaxation, breathing techniques, free limb movement, and also walking slower in order to go back to the heart rate of the beginning of the training, right? So how can we measure the intensity of these exercises in a pool? You can measure the heart rate of the clients. Nowadays, we have so many watches, right, that capture the heart rate. So you can use heart rate parameters. Also, you can use the rate of perceived exertion, how hard I'm working. There are some scales for that the therapists have as well. And so you can keep yourself working in the intensity that is really appropriate for you, okay? And this is tricky, like in terms of findings in the literature, both in the stroke field and also in the neuromuscular field. We don't see much of people reporting intensity, and this is sad, right? Because we want to, like, intensity of exercise is something so crucial for anyone that wants to exercise, and especially also for persons with neuromuscular diseases. So it's important to keep it light to moderate intensity. Just a few examples, right, of exercises of free limb movement. You can use a float and just float through the water to get yourself adapted to the environment, right? So you can also use flotation devices in laying down in the water, floating completely with flotation devices in your legs and in your arms, okay? And here we use a lot of, in the figure of the middle here, we use a lot of this metacentric effect, and we will see how. So if you lift, for example, your arm outside the water, your trunk will try to rotate, and then you have to use your muscles in the center to keep you balanced. So it is a very, very good position to work with motor control and selective motor control. I really love this position. We also have muscle training of arms and legs, especially also in the standing position. And as you could see, we get more of a cardiovascular effect when we are standing in the water, okay? Also, we can work with balance and trunk control, activating. For example, you can ask your client to sit on a board or sit on, usually I use like 2 noodles. The person can sit on the 2 noodles, and then it can keep the feet on the floor at the beginning, and then later progress to taking the feet off the floor. And as you move the noodles forward and backwards, you can activate your trunk extensors and your trunk flexors. So it's a really great environment to work on balance control. And socialization, it's great to just get your peers, your family, go to the pool together and enjoy some time together. So there was one study that measured like qualitative, right, the perceptions of the family after their child had gone to aquatic therapy, and they reported that their 6-year-old child with Duchenne muscular dystrophy increased socialization and quality of life, slept better, got calmer and more confident, right? So it's really great for them. So in the aquatic therapy session, we can also use some equipment. So we have neck floats, especially we know that as the disease progresses, we may have clients with difficulty in swallowing, right? And then they may be a little bit fearful of getting immersed with the head on the water, and we don't want that. So we really can use of neck floats so the client can be more comfortable to try some challenging balancing exercises, because they know if they fall, the neck float will prevent them to, be in contact with the water. You can use the foam dumbbells to create further resistance. Also, simply a noodle. We can do like miracles only with one noodle, right? We can change the shape of the noodle to create resistance to push down to the water. And also we can sit on, like, for example, in this noodle, you're able even to sit on the noodle like that and work on the trunk control, right? The waist belt, it can also be used to increase the trunk extensors activation, and also allow the patient to go to the deep end and work on the cardiovascular conditioning, right? And the swim boards as well are great if your client wants to work more on the muscle training and want to offer greater resistance. So it's also a great equipment to have. And to be frank with you, I think all of them are mostly available in the community centers across Canada. Perhaps less of a neck float, but even neck floats I'm seeing more often. Now let's think about it. Okay, I know what the water properties are. I know the type of sessions that I can have in the water, and how now I can modify these parameters for the level of abilities or disabilities of my clients. So let's think about the buoyancy, okay? The buoyancy, it's something that is there all the time, right? So you can use cuffs in the ankle cuffs to increase the knee and hip extensors, for example, when you're stepping down your leg, if you want to add resistance to your knee and hip extensors. You could also use weights because some clients that still lack like some movement control, sometimes when they step in the water, their leg can float and be a little bit uncomfortable. So you can use weights to minimize the effect of buoyancy, right? And depending on the ankle weight, you can also help this client to gain hip and knee flexors during gait. Some pools, not all, can also offer some different levels of immersion, right? Some therapy pools usually do that. Sometimes they have a ramp going down. Sometimes they have even like a really like leveled, different level of immersion. Then you can work up to the hip, you can work up to the chest. So as you progress to the shallower end of the pool, keep in mind, because of the buoyancy effect, you're going to gradually increase the muscle and joint load. And the opposite is also true, right? So in terms of hydrostatic pressure, if you progress to the deeper end, keep in mind that more volume will return to your heart. So your heart needs to be able to work a little bit harder to pump this extra volume to your body. Okay, our body is very smart, so they end up adapting a little bit, decreasing their heart rate. But it's very important to check with your client how their cardiovascular conditioning situation is, and do this familiarization session in the pool to get everyone checked. Okay. But cardiomyopathies are not a contraindication to the therapy, to aquatic therapy, okay? But we will talk about contraindications at the end. There are some conditions, yes, that is better not to go to aquatic therapy. We also learned about the drag force, right? So that is due to viscosity of the water. So walking forward, remember that it provides more of the drag force, more resistance than walking sideways. And also walk with holding a board or any object in front of you also offers more resistance than without the board. So all these elements you can use to dose your session and to work according to the level of ability of your client, okay, or of your family member. And here comes the metacentric effect. So if we, for example, sometimes our clients are like in a very relaxed supine position, like laying down, enjoying the water, and that is great. We can have, for example, stretching, stretch the trunk, stretch the arms, stretch the legs in this position. But if you want to work on the trunk control, this is a great posture for you. Because as you lift, for example, one arm outside the water, out of the water, you will see that your trunk tries to rotate. And then you have a great time, trying to control your trunk, activate muscles that sometimes you are not aware of in the aquatic environment. Okay, so it's great for this technique to have a therapist beside you, because the therapist can, give some cues for you to activate your trunk muscles properly in order to maintain your trunk control. Even a head movement in this posture can create this metacentric effect and increase the trunk activation. All right, so let's just keep a few minutes talking on the evidence that we have to date. So there is the recent review conducted by my colleague Agnieszka Oslodonik from Poland. She did this scoping review to really elucidate the breadth of literature in aquatic therapy for people with neuromuscular diseases. And these are some highlights from the studies that she collected, okay? There were 16 studies with people with myopathies, 8 studies with people with central nervous system diseases from the spine, and persons with peripheral nervous system diseases, okay? And you can see across that the duration of the whole therapy really varied from 5 to 6 weeks, you know, to 100 weeks, right? So also the session duration is a little bit more in between 30 and 60 minutes. And the frequency of the whole study did not exceed the 3 times a week, okay? It's usually 2 days a week was more common in their studies, because this allowed for other therapies to come in the week as well, okay? And we saw as well temperature of the pool ranging from 28, as I said, near 29, it's better, is the minimal better, to up to 36 degrees Celsius, okay? So the studies that included persons with myopathies, the results that the respiratory function measured on land had like some conflicting results. In 4 studies, it improved. In 7, it decreased, and in 2, became the same, okay? But one study that measured the respiratory, the exhalation of air in the water and compared to the land, we saw that the respiratory function in the water was better than on land. Again, so knowing that this hydrostatic pressure, the support that the client have in the water may have influenced a better cardiorespiratory response compared to the land, okay? In terms of function, in 2 studies, there was an improvement, and in 1, it remained the same, okay? And you can find these more details about the other groups in this review. But what we can see from the remaining of the participants is that function and mobility improved with aquatic therapy. We cannot say yet that's better than land therapy. We don't have enough evidence to say that, but we can say that aquatic therapy does improve function and mobility, quality of life, and muscle strength, okay, in persons with neuromuscular diseases. Also, there was one study investigating pain, and also the levels of pain decreased with aquatic therapy, and most possibly because of the effects of the thermal effects of the water, right? So this is the only, I want to thank Victoria for sending this article for me. I had a look at it, and it's the only randomized controlled trial that we have is aquatic therapy and muscular dystrophy. And this was done in England. They have a health system that is a little bit different from ours. And it seems that the access to the pools are maybe even less than in Canada. Because recently we did an environmental scanning of indoor pools across Canada, and we found more than 500. Only in Ontario, there are more than 300 indoor pools. So we are building this map to let everyone know where the pools are, so it's easier to find them. But I feel Canada is very resourceful for therapy pools or for swimming pools. But the barrier is we don't have the time slot that is feasible for people sometimes with different levels of abilities, right? So what this study did, they end up recruiting 8 people with Duchenne muscular dystrophy on the intervention group, and just one person remained in the land group. So there were many issues related to the way they randomized the participants, and participants were aware that aquatic therapy is good and they didn't want to do land therapy, right? Some participants as well found the pool too far from their place, etc. So we had several issues with this study, but it seems that indicate that at the 6 months of aquatic therapy once a week or twice a week, combined with land therapy in the other days, promoted a less decline in the aquatic therapy group and more decline of function in the land. Okay, so it seems that this we're talking about randomized control trial, that there is a potential for aquatic therapy to be proven better than land for people with Duchenne muscular dystrophy, but some considerations need to be taken before setting up a randomized control trial. This other study here investigated 16 boys with Duchenne muscular dystrophy. They seated for 20 minutes in the water and on land, and they measured the energy expenditure. And they say it's the same because, as you may know, many people a few decades ago, and health professionals, they did not recommend exercises for people with neuromuscular diseases because they would think that they would further deteriorate. They do not recommend aquatic therapy because they think there will be a higher energy expenditure in the therapy. But actually, research is showing that no, it's comparable to land. And I think depending on the temperature of the water, on the level of immersion, it can be even less than land. Right? The clients feel more freely to move. They can do more things in the water sometimes in comparison to the land. So another question, yes, was, okay, hydrotherapy benefit more children or adults? And I would say both, because we don't have research to say that children have more benefits than adults. But one question that we need to make in the future studies is that in which stage of muscular dystrophy aquatic therapy would be essential? In which stage that will be, more important to have aquatic therapy than land therapy? So we don't have these answers yet, right? Maybe the clinical experience of therapists here today and the clients can even guide the future studies to answer these questions, right? In which stage that aquatic therapy becomes essential. Just before we end, it's important to have in mind the contraindications and the precautions, okay? You can replay these later and just have, pay attention on that, but basically contraindications that are like full incontinence, we don't recommend. Every acute condition of vomiting, diarrhea, of course, and also medical instability. If the heart is very unstable, if there is a later stage of cardiomyopathy, please check with your doctor because it can be contraindicated. And obviously, allergy to chlorine, right? Check with your facility what substances they put, to make the water clean. Angina at rest, shortness of breath at rest as well, right? Excess of body weight, because if something happens, sometimes it can be difficult to take the client out of the water. Open wounds that are not covered with tegaderm, because sometimes we had already clients with open wounds, but the tegaderm was very isolating and nothing happened, right? So you need to check if they have isolated covers for the wounds. Uncontrolled seizures, obviously. I had one client because the pool, the lighting, as you can see here, right? The lighting of the environment and the pool movement, the water movement sometimes can trigger some seizures, so this is not recommended. So here is just like, I am, as I said, I was introduced as also a research advisor for Canada Aquatic Rehab instructors, and I work with Alison Bonima, and she and her client kindly offered us the video, a little bit snapshot of their therapy. And this client was diagnosed with limb-girdle muscular dystrophy in August 2021. He was self-referred to aquatic therapy, and he was going to the pool once a week for 60 minutes. And initially, he reported he was falling once a week. Okay, and then he came to Allison to say, I want to strengthen my core, my hips, and my shoulders. So since then, they have been working together in the pool. But sometimes, for some reasons, personal reasons, he's off the pool. He doesn't go to the therapy, and he does feel his function deteriorating. So for this client, particular client, the therapy, aquatic therapy, really helps him to maintain his function and independence. So you can see there, Allison, using the noodle, as I said, for him to sit and recline back, and then sit back up, working the trunk control and muscle training of the trunk for the client, which seems to be very, very beneficial for him. In this other slide, we also have a video of the client walking with minimal assist. So here we can see that he does independent schooling, transitions, and swimming using hands and feet in the water. Okay, and then he works in the deep end as well. And Allison said that this increases the work of breathing for this client, but he tolerates well working like 1 minute in the deep end and then go back and relax a few minutes, then go minutes again. So all depends on the response, right, of your body to this environment. So he's able to work front and back in the pool with minimal assist, which is not able to do that long distance on land, okay? And he maintained his range of motion in the joints and is able now to recruit the glute muscles and the shoulders muscles as well. And within 3 months of regular therapy, he reported now that his frequency of falls reduced to once a month. So instead of once a week, it came now to once a month. So I just want to offer some resources for you. This I think will be as well, it's being recorded in the video. You can access some free resources online if you want to review, the foundational aquatic therapy properties. So you can Google access this link here. Free foundational course is 55 minutes of lecture, free lecture for you. Also, there is the Canadian Aquatic Rehab Instructors website where you can find an instructor that can be near your region that could support you. Also, there are a list of aquatic courses there. And if you want to contact Allison to arrange specific courses, for clients and family members of persons with neuromuscular diseases or for therapists, please contact Allison. She's willing to support you in the training if you want to. I just want to thank you. I think I went a little bit further, but I'm really grateful to be here today. Thank you, Victoria, Omira, and the Muscular Dystrophy Canada for inviting me. And I hope that the knowledge that I have today about aquatic therapy may have helped you to understand more.
Absolutely. Thank you so much for a really clearly and well-delivered presentation on hydrotherapy. As I mentioned, we actually did get a number of questions ahead of our webinar that I know you had addressed, but it'd be helpful just for the clients who share this. Really, one of the key questions was around how long should these therapy sessions last? Is there sort of a number of minutes or hours for which a hydrotherapy session would be most beneficial?
Yeah, I would say the minimum 30 minutes, right? Even if at the beginning you cannot reach 30 minutes in the pool, it's great to progress to that because it's where we see the circulation dynamic changing. So first, when you stand in the pool, the blood comes out to the center, to your organs, and later it comes this redistribution of blood to your muscles. So this is a beautiful dynamic to have. right? For you to experience the whole effect, a systemic effect of the water. So I would recommend at least 30. And then the maximum is really about your tolerance, right? Nobody wants to go beyond the tolerance. So works with your therapy to find the right tolerance for you. And as I said, some scales of rate of perceived exertion can be used for you to say, oh, no, this is my limit. Let's go back, right? So
That's great. Actually, there's two similar questions that came about this, which is one, someone messaged today to say, what would be good indicators around that tolerance piece, around maybe they overdid it, or well, what would they feel or experience the next day or later that day to tell them that they might have exceeded their tolerance capacity?
Yeah. So I think fatigue is something that can show that you exceeded your tolerance capacity, right? So there are some fatigue scales that you can use. I'm not so familiarized, but your therapist might be. Maybe you can use that scale to measure how much you were fatigued after the session, right? To see if you exceeded your level. But I would say the Borg scale, B-O-R-G scale, it's also a great measure for you to perceive if you're working hard or not. But let's say if you can talk but not sing during the exercise, this could be a good level of moderate exercise, okay? If you can talk and sing during your exercise, it means that you are exercising the lighter level. So this could be like a rough parameter of intensity if you take as well this rule. They call gasp and sing rule.
Wonderful. And I guess the next question is actually tied to something we discussed earlier, which is that people have found hydrotherapy quite helpful. And it's helpful to know that 30 minutes is, the preferred or best practice in terms of duration, but the frequency of this has been challenging. And a lot of people have noted the frequency has been challenging from a coverage perspective in terms of funding. Most recently, we were working with someone who received a denial from their private insurance around hydrotherapy. So what has the literature shown? Is it helpful to have those 30-minute sessions daily or once a week? Or is there any evidence around that frequency?
Yeah, so we have the evidence around 1 to 2 times a week. As you could see in the studies, they went up to 3 times a week, right? But it does depend what are the concurrent therapies going, on the remaining of the week, right? Because sometimes what really sometimes prevents the use of aquatic therapy is that you worked so hard in the land therapy that the aquatic therapy, like it's sub-maximum for you. You cannot get so much of the benefits. I think it should be this conversation between your land therapist and your aquatic therapist to see, okay, in the water, I would like to focus on this function because it's where my client performed best. And then on land, you can work on other functions to help you have this whole, right? The whole package. So, but I think if usually the clients have other concurrent therapies, I would say minimum once and average twice a week. Would be already, because we saw the studies, it started showing some benefits only with 1 and twice a week, right?
Very good. And I know you mentioned in today's presentation around respiratory, so lung and cardiac health. And as we know that some neuromuscular conditions can be multisystemic, it can really impact a number of different systems. Does that make someone ineligible, not really a good candidate for pooled therapy? Or what kind of questions can they ask their hydrotherapist to know if they would be a good candidate and that they could actually successfully be involved in hydrotherapy every week?
Yes, I think it's very important to know if you have a stable cardiovascular conditioning, because even if you maybe my heart is decreasing in function a bit because my disease is progressing, but if it is stable, it's totally recommended you still continue pursuing aquatic therapy. As I said, as you enter the environment, depending on the temperature, if you feel shortness of breath, if you feel you're working beyond your limits, then maybe go to the shallower end or talk to your doctor and tell him, well, I experienced the pool yesterday and my heart got out of rhythm and I felt very tired. And then he will be able to, elucidate a few things with you. But as I said, cardiomyopathies are not contraindication per se, are not contraindication to aquatic therapy. We have many studies where aquatic therapy is very beneficial for cardiomyopathies. Mm-hmm.
At MDC, we have something called a community of practice. It's really an opportunity for healthcare professionals in different disciplines to join a virtual community of therapists and clinical evaluators and clinicians. And from the patient or client perspective, it's their opportunity to learn about who is a specialist in a certain discipline or in their area. Where I'm getting at is there a list of hydrotherapists that are regulated as PTs or who have the experience? Is that available as a Canadian resource?
Yes, so if you went to the Canadian Aquatic Rehab Instructors, we have all therapists listed there were trained by Alison Bonneman. So have a certification in one of her courses, at least one of her courses, okay? So she requires, for example, for every attendee of the course to do the free online course. And then in class, and in this, I participate with her in bringing research evidence. So everything that she teaches is evidence-based. So if you go to the CARI website, you will find trained therapists there. Not all of them will be physical therapists. As I said, aquatic therapy is not a private act of physical therapists. You may find physiotherapy assistants, occupational therapy assistants, exercise physiologists. We also train exercise physiologists. Recreation therapists are also part, okay? So, but if you want to get covered in insurance, then you need to be seen by a physical therapist, because physical therapists usually have coverage. Okay, so
And I think that's a perfect note also to end today's webinar, to say at Muscular Dystrophy Canada, we have service specialists who help with system navigation, finding resources, funding, and really knowing what is covered in your area. So if you are a client listening to today's webinar, interested in hydrotherapy and would like to get connected or find out about those funding resources, please contact your service specialist or contact research@muscle.ca, and we'd be happy to support. So thank you so much, Andressa, once again, for a really clear presentation, really laying out the evidence and information that was requested by the community. And we look forward to emerging and more information and research on this topic. As we can see, it's clearly important and really improves health outcomes. So thank you so much.
Yes, you're welcome. Thank you so much for listening and for the invitation to be here today. Yes, thank you.
Thanks, everyone. Have a good rest of your day.
Yes.